Well, it may seem like we've learned a lot about COVID-19 the past few months, but there's lots we still don't know. And that's why Upstate Medical University is launching this week a new 3-month study to monitor family members of those diagnosed with the virus to learn more about transmission and immunity. We're joined now by Dr. Katie Anderson, who's helping lead this study. Dr. Anderson, thanks for joining us again. Appreciate it.
Thanks for having me.
So let's start with really broad picture. What exactly are we hoping to learn from this study? Because there is so much we still want to find out about COVID-19. So what's this study about?
Thank you. So as you mentioned, we're doing a 3-month study of COVID spread in households. And you're correct, there's a lot that we've learned about COVID over the last 3 months. We know that masks work. We know that hand hygiene or washing your hands works. We know that social distancing works to slow the spread. But there are major gaps that we need to fill or address so that we can move forward in how we care for patients, how we develop vaccines. So for example, we don't understand why some people are more likely to get infected. We know there's clusters or hotspots in our communities, and we don't fully understand who is more likely to get sick if they are infected. And second, I'd say we don't yet understand, and this is really important for trying to look ahead and see what the future will look like for COVID in our community or how we develop vaccines. We don't understand what protection from infection looks like. If you're infected, we think you're immune for at least a short period, but are you protected months later or years later? We don't understand that. This study will hopefully shed some light on those questions.
So really, what does that help us then with COVID-19? Is this probably longer term solutions, or is there some short term gain potentially from what we find out here?
Well, we're hoping for both, and we're hoping very quickly to be gathering information for our communities so that we can understand what communities and what people are more likely to be impacted so that we can do targeted public health outreach. So as clinicians, we can try to anticipate who is going to struggle more with COVID and treat them more effectively. It's also important, I'd say even in the short term, for this race to develop a vaccine, for us to better understand the immune response and protection with COVID is something we need answers to right now.
We hear a lot about household contacts. Somebody tests positive, then they're quarantined with their family. Somebody in their family may get it, or somebody may not. Can we learn a little bit more about how or why some people do or don't in a household, for instance, from this study?
Absolutely. So I think the households provide a very important opportunity to really get at who's at risk for infection with COVID, who's at risk for illness. Because using the testing that we're doing, we're going to be able to look and see who has been asymptomatically infected, which means they're infected and they have no symptoms, which right now we're largely missing in our system. And we're also following them to see who develops symptoms, how long they're infectious for. So looking at these clusters of people who are unfortunately at the highest risk of getting infected, we'll be able to answer a lot of these questions.
Who are you looking for? Do you have people selected already, or are you looking for people to participate in this study, and how would they do that?
Yeah, so we'll be enrolling households over the next 3 months. We're trying to get the new cases, so people who have just tested positive, and we're going to be enrolling both people who test positive as well as households who test negative for COVID because they tell us different things. The households that have an active case will be telling us in a very short period of time a lot of information about risks of infection, risks of illness, and trying to tease out some of those factors we were talking about. And those negative households where we don't yet know that they have COVID, over the next few months are going to be giving us a lot of information that just paints a picture of how COVID is doing in our community, who's been exposed and the percent.
So to paint that full picture, then we need both people who have tested positive and people that have tested but they come up negative with their results.
Because they'll tell us different things, right? So the positive households, unfortunately, will have a focused period where the risk is very high of other people getting infected. We hope that they won't be, but they might be. Those negative households will be able to look and see who has antibodies or markers that they've been exposed in their blood and how that changes over time.
What do you need from somebody that takes part in the study? Is this blood? Are they swabs? Are they just filling out a questionnaire? What are you looking for if people kind of know before they sign up and waste anybody's time?
Yeah, thank you. So we're going to be collecting data. We'll be asking some questions. All of these interactions, or as much as we can do, are done by the phone, given the nature of our times in a pandemic. So phone calls, paper forms, things like that. So collecting some data about symptoms, about people's medical conditions, and we'll also be collecting saliva swabs, which is one of the advances that makes this study possible, is that researchers at Upstate have designed a saliva-based test that will allow us to look and see who's been infected, whether they're asymptomatic or not. And we'll be collecting blood as well to be looking for antibodies or markers in the blood that you've been exposed.
I'm going to give you a general one to wrap up this conversation with, away from the study a little bit. What are you seeing these days? Our numbers are looking really, really good. We're heading towards a phase 4. What's that virus like in our community? Has it weakened? Has it gone away just because our numbers are down? What do you think?
I like that question, and I think it's an important one. So the virus is the same. The virus is the same as it was in late February or early March when it came into our community. What's changed has been our behaviors, and we see very clear signs that those simple measures, mask wearing, social distancing, hand washing, trying to limit your movements and your contacts, have worked. So I think as we go into the summer, right now our numbers are looking cautiously reassuring that those measures continue to work. We might have an additional benefit in that when people are starting to, we say, broaden their bubble, maybe they're having a friend over that they haven't, been mixing with up until now. A lot of those new contacts are taking place outside, which I think also helps in terms of lowering the risk. What that doesn't mean, again, the numbers and the trends right now are somewhat reassuring. It's the right time to be taking cautious steps towards opening our businesses, for example. It's not the right time to stop doing those simple measures of hand washing, mask wearing, and social distancing, because the virus has not changed.
Could we be some of these other states we've seen spikes? California, South Carolina, Texas, Florida, the list goes on and on, if we don't keep doing what we've been doing?
Absolutely. So we know, again, based upon antibody testing, that right now more than 90% of us in Onondaga County, for example, have not yet been exposed if we look at people's blood and look for antibodies. So that means we are as vulnerable as we used to be. The virus is the same as it used to be. We know that these simple measures have been working, and there's no indication to suggest that it's the time for us to be letting up on that.
I wish I had more time to ask you even more questions. Unfortunately, I don't right now, so we will invite you back, and I'm sure we'll have your colleague, Dr. Thomas, on again very soon, too, to keep following up on this conversation and about the study as well. But can't thank you enough, Dr. Anderson, for joining us now for a few minutes.
Thanks for the opportunity. Bye-bye.
To read more on the study, head to localsyr.com or the News Channel 9 app. Just click on the coronavirus banner.